Hey, friends and listeners of the Switch for Good podcast. Yep, that's you. I have some really exciting news. Dotsie and I have started a Switch for Good podcast Facebook group. We created it so we can build a community of fans that will help us improve the show and deliver on the topics that you want to learn more about. So we want to hear what your favorite content is, what you want more of, and what you want less of. And if you like the length of the show, Dotsie and I are always talking about the length of the show, right, Dotsie?
Yes.
We want to tailor our show around the needs and desires of our incredible listeners, almost 500,000 of you. And it's really simple to join. Just go to our Switch for Good Facebook page. That's Switch, the number 4, and then Good. And then click on groups. And there we are, the Switch for Good podcast chat. You can post directly in the group, share ideas, talk to other listeners, and connect with like-minded folks. So go, run, join our Facebook group and tell us what you want.
Welcome y'all here to the Switch for Good podcast. I'm Dotsie. And I just want to take a beat to thank you for listening. Thank you for, supporting our voice. We had our biggest jump in growth over the month of December 2021, which is pretty exciting, climbing to the tune of over 35,000 unique downloads in just that 1 month. We are moments away from reaching 1 million unique downloads. So I just wanted to say thank you. Thank you from both myself and Alexandra. We appreciate you. We honor your desire to live better and do more, which is our tagline here at Switch for Good. So today I am a Lone Ranger. My much better half is taking a few weeks off. So I'm flying solo, not super happy about that. As many of you know, Alexandra has done a few shows without me and she always says they are terrible, which they absolutely aren't. But now I am faced with that same feeling. I'm a bit nervous not to have my partner, my co-host, my balancer, my sister in crime with me, but here she goes. And I have been blessed with an absolute badass of a guest. So in theory, this should be smooth sailing. Ooh, also maybe flying solo means I can run my potty mouth a bit more, but no, I won't. All right, so let's just dive right in. Let's get to the good stuff because we have a doc in the house today. Her name is Daphne Bascom, and she is a public health hero. We were first introduced to Dr. Daphne when she reached out to us to speak in 2019, and she wanted to take advantage of our Switch for Good education presentation. And then she followed up again with us this year. When we did a deep dive, we discovered her career is illustrious and spans decades of public and population health work. And we just knew we had to have her on the show. I honestly cannot think of a time in my lifetime anyway, when population health has been more important or vital to discuss than right now. Dr. Daphne has spent her career advocating for the health of every human. She currently serves as the Vice President of Population Health at St. Luke's Health System in Kansas City and spearheads the community engagement program, setting up plant-based milk bars, that's right, and educating both health professionals and the community about the benefits of a balanced plant-based diet. Her secrets include meeting people where they're at and also leading by example. Dr. Daphne is implementing positive change on a massive scale, and we need more people like her in this world. So welcome to the show, Dr. Daphne.
Dotsie, thank you so much for that kind introduction. I'm not sure who you're talking about, but thank you.
You don't recognize yourself? Come on now. It's you. Oh, this is such a joy. You have a really incredible resume. It's honestly mind-blowing. And there's so much to dive into, but I would love to start with the Academy of Lifestyle Medicine, if we could, and then we'll go backwards and back forwards again. But you're a member of the Academy of Lifestyle Medicine. But from what I learned in research, you didn't adopt a plant-based diet until after watching that little documentary, The Game Changers, in 2018. So you were already you're already steeped in lifestyle medicine, which encompasses food, obviously, but you hadn't changed your diet. So what was it that convinced you to really make the switch?
Oh, that meeting. So the ACLM meeting, the American College of Lifestyle Medicine meeting, where we first premiered the Game Changers movie, was life changing for me because I'm not an athlete at the same level that you are, but I've always considered myself a semi-athlete.
You
And
are. Everybody check out her Instagram. Yes, you are. Yes, you are.
And I thought I understood how to fuel my body, but after watching the movie, seeing the evidence, I completely did a 180-degree turn. It was one of those, we just need to throw everything out. We need to completely revisit how we eat, how we drink. And initially it was for health, but then just like a lot of your other guests, as I started lifting up the covers, I realized I didn't understand where my food came from. So when I started understanding more about the impact to the animals, in addition to being in my 50s and the potential impact on my health, it was a no-brainer.
Yeah. I think of nutrition and food and what we put in our body, what our body takes in on a daily basis. So it could be food, it could be what you put on your skin, it could be what you breathe, the air you breathe, what's in the air, anything that comes into our being, because that's the lifestyle that we lead. So what is discussed, let's say Game Changers, what is discussed among ACLM members as far as what we should put in our body?
Mhm. So first and foremost, ACLM is a plant forward organization. Um, they, which is an amazing opportunity for anyone who doesn't know the American College of Lifestyle Medicine to reach out, go on their website, get materials about how to understand how to add more plants to your plate. But the American College of Lifestyle Medicine really has several pillars. I mean, they talk about nutrition, and plant-based, plant-forward is really what they advocate. And they understand that it's a journey. And I know you've had a lot of your guests talking about, there's some people who can do it overnight. There's some people that make this a journey to adding more plants, reducing their animal product intake. But nutrition is fundamental to what ACLM espouses to its members and to the community. But in addition, they also talk about physical activity. So move more, stressing less, sleeping better, reducing your tobacco intake. A lot of it is centered around nutrition, but it really is whole health and whole life that they're focused on.
Okay, so you were eating a plant forward diet, but
No.
not entirely.
So prior to that, when I turned 40, I started doing competitive physique competitions. So, which I did, the last time I competed was 2019. So I started late in the competition stage. Walking in a bikini across stage is something that I didn't expect to be doing in my 40s and early 50s.
It's awesome.
But I was the fish and broccoli, fish and asparagus, steak and asparagus eater up until that light bulb went off. So even though I don't think I heard, I don't know if I was more receptive at that meeting or if it was the game changers and how the documentary framed the evidence, and then seeing athletes like you, looking at the Tennessee Titans, really understanding the data was a big pivotal point for me.
And so when you kind of took in this data, and then I'm sure you went and dove into it as a doc after the documentary, but you're taking in this data, but then there's also our emotional side of our being and the logic side of our being, which you had definitely convinced yourself before, as had I, the logic side with the meat and mostly animal-based protein and vegetables. Like, we'd gotten the memo that vegetables were good for us, but we were doing the other. How did that part of you react? Were you nervous even though you knew the evidence, and how did you make that shift?
I was nervous. because I didn't know. I didn't know. Um, I think even looking at the evidence, I still wasn't certain, what does this mean to me as an individual? But I went all in, and I just figured, if nothing else, if I am adding more life to my years and more health to my years, if there's a slight negative, if I don't compete again, I won't lose anything. But if I'm healthy longer, and that is something that no one can ever put a value to that.
Yeah, that was very forward thinking of you. Because yeah, I guess too at our age, you were thinking about the second half of our life and looking forward and going, gosh, how do I want to feel and be, and how do I want to experience my life and the world at 70, 80, 90, and so this bodybuilding or this
Mhm.
sport is now, but what do I want later on? It's important even for 20-year-olds to think about, but it's tough to think about the second. How do you want to feel in the second part of your life and when you're that age? So you make the shift, and you did it not overnight, but somewhat slowly. Was it a few months?
So I went to ACLM, and then my partner had a hip replacement. And so that was December. In January, I said, you're going to recover better if we get rid of some of the animal products.
Yeah.
So I would say within 4 months, my refrigerator had no animal products in it. I cleaned out what I had and never replaced again.
Okay. And were you impressed, as was your partner, with the recovery?
His hip replacement went very well, and he was back on the treadmill by February. And I was impressed too. But in addition to, I was just impressed with how I felt. And I know you hear that a lot, but it's real.
Yeah.
The mild acne I had went away.
Mhm.
And I think I attribute that probably partly to the dairy, but also to the animal products. But I just didn't feel 50x anymore.
Yeah, yeah. So tell me, quite specifically, what some of those first changes were that you made for you. That's a question that we get constantly to the podcast, to info at Switch for Good. It's like, okay, especially since this is the new year, so many people, they want to make a shift. They don't necessarily want to make it overnight, and they don't necessarily want to do all of it at once either. But what were some shifts that you made specifically? And when you made them, what was the difference? Like, was it more energy? Was it better sleep? You already mentioned the acne went away and you didn't feel 50x anymore. But like, what specifically were you kind of like bounding out of bed? Were you increasing your weights? Like, what are the specifics?
Specifically, I noticed that my recovery was better. So I had a lot of joint pain. And I don't know if it was early arthritis or if it was just because I trained pretty aggressively, but my joint pain became less. My recovery between workouts was much better than it had ever been. I did start to sleep better. I've always, for years, I trained as a surgeon, and so I've always been kind of an early morning riser, but I had also been a late night sleeper. And as part of my re-education, I started putting boundaries on it's time to go to bed, which I think that combined with eating better, it just hit more restorative sleep. I would probably say I felt happier, and I don't know how to articulate that, but I was happy with where I was in, how I was approaching life. My mood was elevated, and the changes I made, they were all the things that your mom always told you: eat more broccoli, eat more beans, eat more whole grains. I cut out the yogurt, the Greek yogurt was gone. I didn't make big shifts. I made little changes, but I didn't miss anything. And I felt so much better that there was no reason to think about doing anything differently.
Important statement that you didn't miss anything, because that's basically the fear for most people. For me too. I switched after 35 years of eating animals almost every day. And that was the fear of, food is emotional and
Mhm.
it's cultural and it's fun. And it's, we do it many times a day. And so I think that is just such a common fear. What are your power foods, let's say? What are your power meals that you feel, lended to that feeling of like, hey, I'm not missing anything. I feel totally satiated and I love these flavors. I mean, it can't just be, broccoli with lemon juice on it, right?
No.
Yeah. What are your power meals?
Well, as I share this, I want to actually preface by saying that for years as a competitor, I had been carbophobic. It was always that carbs are bad, carbs are bad. So when you make the switch to eating mainly plants, you're eating a lot of, whether it's just fibers, carbs, or whole grains. So there was this thing in my brain going, I'm eating carbs. But for example, for lunch, I had crispy tofu, and then I had black beans with some sweet potatoes, and I also had some greens, which I made up at Happy New Year celebration. Black beans are good luck. Black-eyed peas are good luck. My other power foods, I love chickpeas. So there's nothing better than tuna, Toona salad made with smushed chickpeas.
Totally.
I do a lot of it. The wonderful thing I love about vegetables is there's no bad combination. So whether it's white potatoes, sweet potatoes, I have found things like farro, which I had never heard of before. Throw that in a bowl. I just found a recipe for a chocolate pudding made with teff. Um, it- there's nothing that I didn't eat previously that I can't eat now. It's just in a different form. But my big power foods are definitely going to be beans, greens, potatoes. I could eat sweet potatoes every day. And then adding some tofu, tempeh, chickpeas, or black beans to the bowl, and you've got a complete meal.
Yeah. Potatoes are my
Awesome.
power food. And I think they're Alexander's too. We talk about potatoes all the time. I know. And that's such a really good point that, in the beginning, the crispy tofu and the wonderful grains, farro is so satiating. So for you guys listening and haven't tried it, oh my gosh, I think it's more satiating really than any of the grains. And I think I love them all. But all of the beans and all of the potato category, and as you go along, right, your palate changes and your cravings change because you crave what you eat. And they really say it only takes about 21 days for those cravings to shift. For me, it felt even shorter. But, it depends on what kind of diet you're changing from. If you're changing from a plant-ish forward, right? Like you were eating plenty of vegetables, but also a lot of meat. Or if you're transitioning from the drive-through diet, it's probably going to take a little bit longer.
Absolutely.
But getting those tons and tons of greens in, tell people, let yourself get there, because it is daunting to, I eat monstrous massage kale salads, right? Like, and it's just, I crave them. And if I'm out of town and I haven't been able to get that, I find myself like, I want a 5-gallon massage kale salad when I get home. So take it in time and use all the flavors that you were using on the meats to flavor your grains and your potatoes, right? And that's fine. Start there. That would be good. So, in shifting to your career and what you do, and shifting from what you how you kind of practice this plant-based diet on a day-to-day basis. First, I am embarrassed to say I hadn't heard of population health. I'd heard of public health. And it sounds quite daunting because the population is to me, it's the whole wide world. Health is what you're an expert in. So yeah, break it down for us. Break it down for me. Maybe everyone else gets it that's listening, but break it down for me. What is your day-to-day look like? What does an expert and a doctor in population health do?
Nazi, most people don't know what population health is. No. I'm not even sure that the people I socialize with still even know what population health is. So population health is not new. It's something that dates back to the 70s in terms of health systems or medical groups or practices, really looking at not just managing every individual that walks in the door, but really managing the community of patients they serve as a population. So at St. Luke's, I'm responsible and work with a wonderful team of individuals, physicians, nurses, care managers, social workers, community health workers. And our goal is to manage the health of all the patients that walk in the door at St. Luke's. And it's looking at not just, Dotsie walks in the door and looking at her health statistics on a regular basis, but really understanding the community and all of those patients that are attributed to us. And a lot of this is whether it's through Medicare or through commercial-based health plans. There are community members that receive the majority of their care at St. Luke's. And our goal is to make sure they receive their prevention, their maintenance, that they meet all of their health milestones in a way that helps keep them healthy so that they don't get sick.
Mhm.
So I love to think of population health as how do I keep people out the hospital? It's a little different than public health in that we don't necessarily focus on the things that health departments do. We're not looking at specifically sexually transmitted diseases or community vaccination rates or some of the other things that a public health department would, but we're trying to focus on making sure our patients with diabetes have their blood tested appropriately to make sure they're being well managed, or that everyone who walks in our door has their blood pressure taken and that their blood pressure is within a normal range. We're really trying to help our community be healthier. And we partner with public health, and I think of the two as legs of a stool.
Okay, that's really well put and well described. I think I'm tracking right with you now. Um, so what are the conversations like with the other doctors and the nurses and the whole team, the whole wonderful team you mentioned, the support system, maybe of those that are not a part of the academy or their college, I should say, I keep messing that up, of lifestyle medicine, and don't necessarily have a belief in nutrition really changing the potential for disease down the road or even currently. How is that balanced with the staff and then the patients so that they leave, like you said, to not return to the hospital?
Mm-hmm. Oh boy, that's a loaded question.
Yeah.
So in our health system, we don't have a lifestyle medicine program. So
Mhm.
I can probably think of, there's probably a handful of providers at St. Luke's that are members of the American College of Lifestyle Medicine. And I'm not actively practicing. So my day to day is really trying to, I work with a lot of data. I work with a lot of different teams. I help build programs to help keep people healthy. But the truth is that from a healthcare perspective, we're not compensated to necessarily keep people healthy. So the conversations that should be occurring when people walk in the door and we need to talk to them about nutrition, physical activity, stress management, sleep, we don't always have time to do that. So I
Yeah.
think every person that is in healthcare today, their goal is to keep people healthy. The challenge is that our incentives aren't appropriately aligned. For someone to spend an hour doing a coaching session when they could probably see 4 other patients, they're not going to necessarily get paid the same as they would that one person versus the 4 people. So we have a focus as a system on disease prevention. We have a focus on health equity, but we're doing it under the umbrella of operating in a framework that is still, we are compensated to really manage sick care
Yeah.
as opposed to health care, which is why we do a lot of the programs that we're doing in the community. We provide free webinars for the community members that they can learn more about how to implement some of those lifestyle changes that will keep them healthy. But the day-to-day practice is still very much unchanged. We don't have a group like the Rochester Institute of Lifestyle Medicine, or that you may have seen with some of the lifestyle medicine clinics that are popping up at the VA. We're not there yet.
Yeah. So it's perfectly put, sick care and instead of healthcare, and to keep them out of the hospital, there has to be a focus on the healthcare. So you mentioned health equity. Define health equity, and then how the pandemic shed a light on it.
That's another amazing conversation. So
you got time. We got time.
I like to think of health equity as providing every person the opportunity to achieve their optimal health potential. And I know that's a loaded phrase, but we're not all on the same playing field. I think the pandemic actually helped highlight, the pandemic did a couple of things. One, it really raised a focus for why population health is important, because there are parts of our population, parts of our community, and I'll use community, not population, because these are people, and I really think of them as individuals that are not, they may not have access to nutritious food. They may not have the funds to buy nutritious food. They may not have transportation to get to nutritious food. They may not have access to healthcare. They may not have access to getting a good job. They may not understand, similar to what you're doing for Switch for Good, they may not understand that dairy is not a health food. So we need to find a way to level the playing field and to understand what are some of the root causes that have created systemic injustices that are differentially impacting different communities, and which prevent different communities from achieving that optimal health potential. And we've seen how COVID has had a differential impact, whether it's Black, African American, Latino. We know that there are ways to optimize the health of the communities to reduce the risk of succumbing to some of those diseases. And not just COVID. Heart disease still killed more people last year than COVID did. And those same communities are negatively impacted by the risk factors that put them at risk for cardiovascular disease.
Yeah, I know in 2020, I haven't looked at the 2021 data, and you're a doc, so you obviously already have, but just in the United States, 690,000 people died of heart disease and 345,000 people died of COVID in 2020. But you mentioned the root cause and some underserved communities, underserved populations, African Americans, Latinas. I feel like the news makes us think that they're more susceptible to COVID because the color of their skin, like they're not explaining why. Will you do that?
I can give it a try. And I think, have you had Dr. Williams on your podcast, or anyone?
Kim Williams?
Kim Williams. I thought so.
Pre-pandemic though, it's great to have him back. I know.
You do.
Yeah.
So whether it's Dr. Williams or some of the docs from the Slave Food Project, I will not do as good a justice as they will. And I know that they would be excellent guests to have. Your race does not determine your destiny. And I know you've heard that before. Your zip code is probably more likely to dictate your health outcomes and your susceptibility to diseases like COVID or cardiovascular disease than anything else. So your ability to access preventative health care, your ability to access some of the basic, I don't want to say life-sustaining, but whether it's nutritious food, whether it is access to medications at the appropriate time, place, and for the appropriate cost, these are all as or more important than your race in determining your ability to get or stay healthy. And I think Dr. Williams and was a co-author and I'm trying to remember, there was another co-author. The American College of Cardiology actually published a wonderful paper toward the end of 2020, and I can't believe it's already been a year, around the need to have health equity as a focus for eradicating some of the chronic diseases that continue to plague the United States and worldwide, but which are definitely negatively impacting different communities in the United States. And some of it is economically based, socioeconomically based, I'll say, because some of those communities do not have the access to some of the fundamental things that can optimize their health. And the goal is to provide education, empowerment, and that empowerment could be economic empowerment by bringing jobs and other things into those communities, and then also engaging the communities and helping uplift themselves so that we can start to move beyond where we are today and have a more equitable system. But it's, I'll be honest, we've been talking about this. This isn't new. I think whether it was George Floyd, whether, I mean, 2020 was a painful year. 2021 was a painful year, and not just because of COVID, but because we continue to see how different communities, a lot of communities of color, some, not always communities of color, are just not able to achieve some of the things that they would like to, whether it's health, or from an economic perspective.
Yeah, I want to kind of go into that knowledge building and that self-empowerment. As you know, in the New York Times, there was an article that covered a global health study, which covered data from 1990 to 2017 in 195 countries that found poor diets were linked to 1 in 5 deaths. And then, as we were just speaking about during the pandemic in 2020, the health data that we have from the CDC covering just the United States showed us that it was really possibly much higher than 1 in 5, as 85% of the people who died had a comorbidity, and 65% of people who lost their life had obesity. The common comorbidities that show up, because they were charted, they would say they died of COVID, but they would chart their comorbidity if they knew of one. And they were obesity, heart disease, type 2 diabetes, and others, So of course, some, but not all of these comorbidities can be linked to as a foodborne illness. And again, certainly not all, certainly not the entirety, just a link we know from our review of research. So that begs the question of, why that's not being talked about, and why we aren't being, our knowledge isn't being built by our government. Would hopefully be the one that would maybe bring that up. So how can we, or you, people are going to listen to you more than me, as they should. How can we, or how can I take your work too, and educate some of the folks that some of the power is in their hands, and how do you, as a doc, how can you make that impact and empower others like me to make an impact in that knowledge building and that self-empowerment? Because I just think it's so self-empowering to find out that I play a role in my own health and the possibility of my risk of getting certain viruses.
First of all, I want to applaud you and Switch for Good for advocating for the community. I mean, going before Congress, testifying, I get fired up on this topic because there's a level of, we have to start at the community level. We have to educate and empower them, because I don't see it happening at a higher level up. And you know that from when you testified. All of the evidence that you brought forward, and yet our food guidelines, did they really change? No. And so we have to make sure that from our youth on up, they understand what does it mean to eat a healthy, nutritious meal. What are your options? What are your opportunities? How do we counteract some of the marketing? I don't want to say disinformation, but it is disinformation um, that is negative, that is, adding to the obesity in our pediatric population, that's continuing to result in increasing adult obesity across the United States, which contributes to all of the chronic diseases that we're seeing. I feel strongly that if we don't educate the consumer, and you said this, you and Alexander say this all the time, you vote with your pocketbook, so you can make consumer-based decisions that can help direct where investments are made, which is why we've seen plant-based foods grow, non-linearly over the past 2 years. But the conversations that are occurring at a national level are just hurt my heart, because I don't know if people are listening. When we see what Canada did in terms of removing dairy from their food plate, I applaud them.
Yeah.
And there are enough, whether it's the dairy industry, whether it's the meat industry, whether it's pharma, there are enough pressures at a national level that are not going to make this conversation easy, that I don't know. You need to continue the work you're doing and not feel like you have to be a weeble. You're going to wobble, but you
Yeah.
can't fall down. But we have to tell the people, we have to tell our kiddos, here's what you need to be healthy, because that's where health starts.
Yeah, there's certainly some large gaps in preventative health. If you just speak about the United States in a spoof campaign we just did to encourage Starbucks to drop their plant milk upcharge. And 3.5 weeks later, they dropped their plant milk upcharge in all 1,100 of their stores in the UK.
Kudos.
And so that's for sure exciting. We definitely hope that Canada and the US will be next. But so many people ask, oh my gosh, this is like a no-brainer. Like what should happen in the US? I guarantee you it probably happens in Canada first, because so many people don't know this, and only doing this work is why I take this horrendous deep dive into the underbelly. But as we know, our US government is deeply in bed with the dairy industry. So is Starbucks. So Starbucks spent $750,000, just shy of $1 million last year in lobbying with the dairy industry on the Hill. Yep. Okay. That's, you can look that up, what anyone spends in lobbying. So the truth is, if you go to Starbucks in the United States, multiple powders and syrups have dairy in them, where they do not in, let's say, the UK. Like if you want a pumpkin spice latte here, you can't have it if you're dairy free or vegan, but it's vegan in the UK. So that's why, because they are in bed with the dairy industry, and they stuff dairy in places where it doesn't even need to be stuffed. It's just as delicious, the pumpkin spice latte in the UK, as it is. Well, I'd say it's yummier, because you're not going to be coughing and wheezing and having diarrhea after it. But that's why. So we've got much more of a fight on our hands as far as that happening in the United States. But I digress. But where do you think the largest gaps are in preventative health?
My personal opinion, multiple levels. One, I don't think that we teach it well at the grade school level anymore, and I think there's an opportunity to start young and help students understand what health means. You've also had guests on your podcast that have talked about the fact that I didn't learn about nutrition when I was in medical school. I learned about malnutrition. I learned about the diseases that are related to conditions that I'll never treat in the United States, but I never learned about recommending a healthy, nutritious dietary plan to the people that I would be treating. And it's one of the things the American College of Lifestyle Medicine is focused on, which is making sure that we augment medical education so that our practitioners, and not just physicians, this is across all specialties, because I think anyone who touches a patient has an opportunity to make a difference. So whether you're the physician, the nurse practitioner, the dietitian, the life coach, everyone in that group should have the knowledge to understand what are the recommendations for healthy living that we need to provide to our community. So education at the professional level, education at the level of youth, and then I would also say that we need to do better in our schools, because that's where a lot of habits are made and formed, and it's where children spend a lot of their time. So why, and again, you make great strides in actually having soy milk approved as an appropriate substitute for dairy milk in US public schools, but now it has to be paid for. And now we also have to make sure the kiddos know that soy milk tastes okay and it tastes good.
Yeah.
So there's a lot of different barriers. I think there's a lot of levels, but I really feel strongly that if we don't start with our youth, we're going to continue to perpetuate the chronic disease pandemic that we're continuing to experience with our adults.
Mhm. Yeah, for someone that is listening to what you were just saying, but is not a doctor or a nurse or an educator, but maybe is in a privileged position in regards to health and limited barriers, how can the everyday person, which is me, support public health in a meaningful way? Like it's tough sometimes. You're like, oh, I don't want to run my mouth, and it's like, and it's not, I'm not an expert like you are with the right letters. Many of us behind our name was like, okay, I trust you in this. But how can we be supportive and uplifting and empowering that you found, because you've been in this for a very long time, that you find when you see it in action, people listen to and they are empowered by?
So first, I need to say, whether it's to you or to anyone listening, you don't need letters after your name. You just need to speak the truth, and to speak truth that is backed by evidence. And I know it, sometimes listening to people with credentials, people think it's the gospel,
Yeah.
but we also know it's not. There's lots of different polarizing opinions that are out there right now on a variety of different topics. And we won't talk about the diet wars as a good example of what is a healthy eating pattern, because that's probably a whole nother podcast.
Right.
But from a general community member, I think that there's a couple of things they could do. I would definitely, and it's one of the reasons I reached out to Switch for Good. You can advocate and you can obtain educational material that you can share with your community. And that material can come from an organization like Switch for Good that will provide you with a curriculum that you can present to other members of your community. If you really love this topic and you love nutrition, you could apply, for example, to become a Food for Life instructor through the Physicians Committee for Responsible Medicine. And they provide you, again, with the tools, the curriculum, the education to hold small group sessions where you can engage with members of the community and help deliver this message in culturally sensitive and culturally appropriate ways. It's, not everyone eats the same, but, a good example is part of my class, they asked me to veganize a pozole recipe. And we need to be able to translate that into, if you eat Mexican, if you eat African American, if you eat, what is your culture and how can I help you add more plants to that cultural milieu so that you are continuing to eat as you did with all of your family previously. I would also say that community members could volunteer at organizations like the YMCA, like the Boys and Girls Club, that offer community level programming. And we provide you with some of the tools to have the conversations, or even just coming out with us and do a community walk and have opportunities to participate in programs like Walk with the Doc, where you're not only being physically active, but then you can have that one-on-one conversation and talk about what does it mean to eat nutritious meals and how do you add more plants to your plate. So I think there's a lot of ways the community can get involved, whether it's a volunteer perspective, whether it's I want to have some more letters after my name and get a certification. And then one last thing, and I'll be quiet, is there are still a lot of communities where food insecurity is a problem. So volunteering at mobile food distributions, at food pantries, those are other opportunities to have one-on-one conversations, but also make sure that people have access to food in general.
Yeah, I love Chili's on Wheels too. They're New York based. So if you live on I think there's there a few, yeah, it's a fabulous program that gets plant-based meals to those who need them. Thanks for mentioning this Switch for Good educator. I don't know that we've ever even brought it up on the podcast, which is strange that we haven't. But if you would like to give our presentation, whether you're like, if you're a runner and it's your run club, or you're a cycling club, or to your gym, or to your community center, or to your church or your synagogue, or wherever, just email us at podcast@switchforgood and I'll send it right over to you. It is a powerful way to help people learn. And I think, thank you for saying that, not necessarily having to have the letters, because I think that people really they do tend to lean into people that they can relate to. Mm-hmm. For sure, and that's not always a doctor, right? It's a friend or a colleague or someone they respect in their community, and they don't have to have necessarily the letters behind their names. And also, you brought up one of the most important points is, food is so cultural, and it's really important to pay attention to who you're speaking to. We did like a pilot program in 2019 at a charter school here in Santa Ana, California, 95% Latino. And I took with me Megan Sad, who's a fabulous vegan chef and makes incredible Latin food. That's kind of like her thing, making vegan cheeses and Latin. So anyway, we did a whole, we kind of did the educator around the table with just a ton of the parents who came to it, teaching them about health. And then we went into the kitchen, and she made quesadillas and tamales, and it was mind-blowingly delicious, as you know. And I mean, they just lit up, because what they said was, I knew I should be eating more plants, but this is the food that we love, and our culture love, our community loves, our family loves, and I had no idea how to make it healthier. Yep. So that was super cool. I want to talk about your milk bars, MYLK. Gosh, it was what inspired you to start these, and how'd you put the idea into action?
So my first milk bar was when I delivered your presentation, your education presentation, at one of our employee education sessions. So we have a wellness program at St. Luke's where we give our employees time. Usually it's over the lunch hour, and different individuals are invited to give a lecture. And I did the Dairy Does a Body Bad lecture. And what I wanted to do was to give them a chance to taste different plant milks. So I think we may have had 10 different plant milks.
There's a lot.
So that went over so well. So at the end of the lecture, we did a tasting session, and then I just encourage people, if there's one you like, take the jar home with you. I want you to have an opportunity where you don't have to make the investment to try something new. And when we started our Reach-In program, which is a community-based program Region stands for resilience, education, activity, community health, and nutrition. Sometimes it's hard to try new things because it's an investment. And whether you're going to try almond milk, oat milk, pea milk, hemp milk, if you don't want to pay $4 for a carton if you think you're going to have to throw it away. So what we decided is whenever we're out at a community event, we're going to have a milk bar, and we'll give our community members the opportunity to try some of these plant-based milks and to see that they really taste good. And that's how we started. I've become the milk lady, I think. But we have had an opportunity, whether it's at the Boys and Girls Club with the kiddos, with their employees. We did it at a health fair. And it's just so much fun watching people taste the different milks.
Yeah. What are some of the favorites? Let's say there's someone listening and they haven't tried them plant milks, or maybe very many, right? Because there literally are, you guys had 10, I think there's like 15, right? I mean, but there's probably 8 that are typically at the grocery stores. That's still a lot to choose from. Like which one were people like, oh yeah, this is really delicious, I could do this every day, this is my replacement? Was there, can you rate like 1, 2, and 3 in order of what people loved?
I'd say almond milk, oat milk, and then probably soy milk would be third. Mm-hmm. But I always tried to purchase, so I live near a Sprouts. I can walk to Sprouts from my house. So many times I would actually purchase the milks at Sprouts and to take them with me to the event. Aldi's has also become a great place to get plant-based products. So what I try and do is shop at stores that may be in the communities that we're going to, so that they can try something that they can go purchase on their own if they want to. So the oat milk, the soy milk that are available at Aldi's are also great options. Pea milk is actually up, I'd say, in the top 3 or 4. A lot of people like the pea milk, but it has some added chemicals that I love Ripple, but I love, Elmhurst oat milk is one of my favorites because it's oats and filtered water. Yeah. That's it. And so I try and keep it as close to the whole grain as possible when we're letting people try. So we don't bring a lot of the sweetened ones in, although I did bring a banana milk. Everyone loves the banana milk.
Yeah. Naturally sweet. So delicious. I just tried banana milk. We did like a plant-based milk taste test video the end of last year that everyone's really loved, because they're, everybody's asking, which one's the best? Like, I don't want to go buy all 15. So, and I don't want to go through, like, just tell me. And that was the first time I tried banana milk, and some other milks that I would say not so much, like maybe the flaxseed. I just sprinkle the ground up flax seeds on my salad. I'm just going to stay there. I find like oat and soy are the 2 that you can get with just the grain, just the oat and filtered water, or soy and filtered water, that still is like thick and creamy and still tastes great.
I agree.
That you don't have to, give any help to at all. And gosh, oh my gosh. I mean, oat milk, like scrubbing out your arteries as it goes down, and soy just giving you, it's really interesting to see soy, like 8 ounces of soy milk and dairy milk, head to head, because it literally has the exact same macronutrients, except it's lower in fat. So we like that. But just so much more of a robust profile in the micronutrients. And so we have a graphic or a meme that has the 2 next to each other, because same amount of calcium and vitamin D, which is fortified in all of it anyway. That's what people get hung up on, right? But I need this calcium and the protein, the vitamin D. Like it's got all of that and better.
And that's been a great addition to your website. So being able to click on the milks and then just have that graphic come up with the red and the green and the yellow.
Oh, cool. Yes. Yes. It's like the milk calculator.
The milk calculator.
Yes. Yes. That was, you know what? The team is so awesome here. I literally did not know that existed. And I'm searching around and I find it, and it was hidden. It was like, in a column under a specific, I took like 4 clicks to get to it. And I was like, what is this? Why is this not on the homepage? This is
great.
Amazing. Yeah, it's been hidden for quite a while, but it's not hidden anymore. So go have some fun with the milk calculator, I think. Oh my gosh, this has just been so fantastic. I do want to highlight your Reachin program that you mentioned, standing for Resilience, Education, Activity, Community, Health, and Nutrition, because it's free. It's a healthy living program. Mm-hmm. And it's an 8-week course. Mm-hmm. So many incredible session topics. Just wow. What can people do to get involved?
So I can send you a flyer, and they can either sign up on Eventbrite. They can email us. I co-facilitate Reachin with a member of our community. It's a community health worker. His name's Oziel Pruneda, and Oziel is bilingual. And we started the Reachin program in an area of Kansas City that's predominantly Black and Latino. So I wanted to make sure that we could have conversations in English or Spanish if needed. And you'll see that we also translate the majority of our material into Spanish. So we're trying to be as inclusive as possible. The course is free. It will continue to be online for now, although we're hoping to move back to in-person sessions. And I think the highlight has been for those who are able to attend in person. So I do cooking demonstrations as part of the course. I also curate all the recipes. So course participants get recipes every week. They get a shopping list. And when we're able to do it in person, we also provide a bag of free produce and some shelf-stable foods from harvesters that aligns with the recipe that I'm doing that week. So if we're going to make, we did tuna salad. So they got all of the fixings to make the tuna salad. So they didn't have to go out and purchase it.
Toona.
Toona, yes. Tuna. But it's a great opportunity to try new recipes, to get produce and food that you may not try on your own, and then to have conversations about being healthy.
Yeah. And can someone can give this presentation if they want?
Well, we haven't actually made it publicly. So no, not yet. All of the content, yes and no. We started with the content that was based on a curriculum called Steps Forward, which is a evidence-based curriculum that's available from the CDC. I have localized it to make it fully plant-based and to insert some of me into the conversation. So we've added in, we do a lecture on sleep, we do a lecture on stress, we talk about resilience. So it's not the typical, it's not like a diabetes prevention program where we only focus on nutrition. It really is whole, healthy living.
Okay, so somebody can access this for free and show it. Let's say they wanted their community center to see it or something. They could do that.
We haven't made it available, but yes, they could.
Okay.
I mean, if they were interested, we'd be happy to. All the content is ours, so and none of it is proprietary in that it's all publicly available information.
Okay. Incredible. So incredible. Well, I think I vote for you for Surgeon General. So if you're if you're bored, you're like, how about no?
No.
Gosh, this has just been epic. Loved every second. Thank you so much. And we made it through without Alexandra. We did it. High five. It was tough. No, it was a joy. You're such a pleasure to speak to. And gosh, I learned so much, and I know our audience did.
Dotsie, thank you.
Hey, folks. Okay, back by very popular demand, is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switchforgood.org. That's podcast@switchforgood.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review and zoom, zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.